So in this lecture, we will be discussing about a category of interstitial lung diseases that is labeled as IPAF, which stands for interstitial pneumonia with autoimmune features. So when we were reading about the classification of ILD, I told you that ILD could be divided into two broad categories that were unknown etiology and known etiology. So the ILDs with unknown etiology were known as IIPS, that was Idiopathic Interstitial Pneumonia. And under known etiologies, you had various categories, out of which one important category was CTD ILD. So CTD ILD are those patients who have a known CTD, that is, they have a known connective tissue disease. They meet the diagnostic criteria for that connective tissue disease, and along with this, they also have an interstitial lung disease. So IPAF is basically a category of ILD that lies between these idiopathic diseases and CTD ILDs. So it lies somewhere in the center such that the patient has an ILD. And along with the ILD, he has certain autoimmune features, which could be in the form of some clinical symptoms like joint pain, arthritis, palmar telangiectasias, Raynaud's phenomena, etc. There could be certain clinical features or laboratory features or radiological features that suggest the presence of autoimmunity. But the patient does not meet the diagnostic criteria of a known CTD. So therefore, it's somewhere in the middle. One end of the spectrum are idiopathic interstitial pneumonias, where there is only ILD and no autoimmunity. On the other end, we had CTD ILDs, where there is ILD as well as an established connective tissue disease, and IPAF is somewhere in the middle, where there is ILD and there are certain features of autoimmunity which could be clinical, laboratory, serological or radiological or histopathological, but it is not that strong to label the patient as having a CTD ILD. So it is an in-between category. What is the importance of this category and why has this category been established over the last few years? The reason is, if we talk about IPAF and we compare it to patients with idiopathic interstitial pneumonias, so patients of IPAF actually have a better prognosis as compared to the idiopathic diseases. They have a better prognosis and also they respond better to treatment. So till 5 years back, when this term IPAF was not coined and this category of ILDs did not exist, most of these patients were actually placed into the idiopathic interstitial pneumonia category. And this was wrong because these patients actually fared better than the other patients and they responded to treatment better.